Why do Black communities need to be vaccinated?
I need to acknowledge and validate the need that many people have had to take pause and think about the vaccine and whether or not they want to get it. Because the institutions that are telling us to get the vaccine, that's the government, the healthcare and public health institutions, and the research institutions, those are institutions that have not had a good track record of valuing Black lives. Those are institutions that have not answered our calls for help in the past, and those are institutions that actually, at times, really mistreat us, even in the hospitals every day.
Understand, too, that the Black community has suffered at the hands of various organizations with vaccines and testing, and they've been lied to, so now they're scared.
I understand the need to cause, or the cause for pause. I understand that, and even I paused for a moment and looked at the literature. But I still think there are good reasons to get the vaccine, or to get at least one of the COVID-19 vaccines. So I have been vaccinated, and my reasons really are looking at, first of all, like the COVID-19 virus, again, has disproportionately impacted our communities.
I think regardless of whatever side of the fence you sit on, I think it's important to do your homework and do your due diligence to be as knowledgeable about the vaccine as possible. But I think it's something that is important for everyone to do it and take it if they can, because it's just for the greater good, right? It is for us to go back. I don't think we'll ever go back to how things were, but at least go back to a new normal.
I'll take the vaccine.
And why for you?
To keep me and my family safe as well as those around me. My mind absolutely changed too, because before I thought that it was too soon for a vaccine to be made, and I was looking at all the risks thinking, what if I get one of the risks? What if that happens to me? Whereas now I feel, because I am more informed, I am more aware that I'll absolutely take the vaccine. Every medication has side effects, such as Tylenol or Benadryl, and I felt more comfortable knowing that, yes, those things have side effects, but just because they have side effects doesn't mean you're going to get all of them or one of them.
The research that went into this vaccine didn't just start. The things that were put into it to try and develop this vaccine, they had been testing from time back. So they're kind of, I think they put themselves in a good position to be ready to provide this vaccine to us. So I think a lot of research and study went into it. So I'm gonna take it. I mean, I'd rather be safe than sorry. Like I feel like I'm rather worse off not taking it than taking it and just, like a lot of people have taken it and they're good, so,
The analogy I give is like, God forbid somebody after, today goes out in the street, gets hit by a car, you fracture your leg, and then for me as a physician, my advice is gonna be to go to the hospital. Even though I know that racism is there, even though I know that history and legacy is there, I'm gonna do that calculation and say your best bet, given what has just happened, is to go to the hospital. Your best bet, given what has happened to us in this pandemic, really is to get the vaccine.